In this video, we will discuss the Hepcidin-Ferroportin Axis, which deserves special emphasis because it represents the single most important mechanistic insight in anemia of chronic disease. And it fundamentally reframes how iron must be understood in this condition. In iron deficiency anemia, iron is genuinely absent from the body. Stores are depleted, the bone marrow is starved, and supplying iron corrects the problem. Anemia of chronic disease operates on an entirely different principle. In this condition, the body's iron stores can be completely normal or even elevated, yet the iron remains functionally unavailable. It sits locked inside macrophages and liver cells, blocked by hepcidin's suppression of ferroportin, unable to reach the bone marrow that urgently needs it. A simple way to picture this: imagine a warehouse fully stocked with building materials, representing the iron, but the loading dock doors have been sealed shut by hepcidin. The construction crew, representing the bone marrow, stands outside unable to access what they need, not because the warehouse is empty, but because the doors will not open. The supply exists, the access does not. This distinction carries a direct and immediate clinical consequence. Administering iron supplements to a patient with anemia of chronic disease will not meaningfully correct the anemia because the problem is not a shortage of iron, it is a failure of iron transport and distribution. Giving more iron simply adds more material to a warehouse whose exit is already blocked. This is precisely why reaching the correct diagnosis matters in actual clinical practice, not merely on paper. In anemia of chronic disease, also called anemia of inflammation, pro-inflammatory cytokines such as interleukin-6 induce hepcidin production in the liver, which in turn binds to and promotes degradation of ferroportin, the main iron exporter on enterocytes and macrophages, leading to retention of iron in storage sites and hypoferemia despite adequate or increased total body iron stores. This prevents iron release into the circulation and limits its availability for erythropoiesis, resulting in functional iron deficiency that underlies the anemia seen in chronic inflammatory states. Hepcidin's key role. Hepcidin is an acute phase reactant upregulated by inflammation via IL-6-mediated JAK-STAT signaling in the liver, and is the principal regulator of iron homeostasis in anemia of chronic disease. Ferroportin function. Ferroportin is the only known cellular iron exporter. Hepcidin binding causes its internalization and lysosomal degradation, blocking cellular iron export from enterocytes, limiting absorption, and macrophages, limiting recycling. In the next video, we will go over inflammatory states, mimicry of iron deficiency, and the TIBC distinction.